Chapter 2020 Coagulation of Blood, Definition. Coagulation or clotting is defined as the process in which blood loses its fluidity and becomes a jelly-like mass few minutes after it is shed out or collected in a container. Factors involved in blood clotting. Coagulation of blood occurs through a series of reactions due to the activation of a group of substances. Substances necessary for clotting are called clotting factors. 13 clotting factors are identified: Factor I, Fibrinogen; Factor II, Prothrombin; Factor III, Thromboplastin, tissue factor; Factor IV, calcium; Factor V, Labile factor, Proaccelerin or accelerator globulin; Factor VI, presence has not been proved, Factor VII Stable factor; Factor VIII, antihemophilic factor, antihemophilic globulin; Factor IX, Christmas factor, Factor X, Stewart-Prower factor; Factor XI, plasma thromboplastin antecedent; Factor XII, Hogaman factor, contact factor; Factor XIII, fibrin stabilizing factor, fibrinase. Clotting factors were named after the scientists who discovered them or as per the activity, except Factor 1X. Factor IX or Christmas factor was named after the patient in whom it was discovered. Sequence of clotting mechanism. Enzyme cascade theory. Most of the clotting factors are proteins in the form of enzymes. Normally, all the factors are present in the form of inactive proenzyme. These proenzymes must be activated into enzymes to enforce clot formation. It is carried out by a series of proenzyme-enzyme conversion reactions. First one of the series is converted into an active enzyme that activates the second one, which activates the third one. This continues till the final active enzyme thrombin is formed. Enzyme cascade theory explains how various reactions, involved in the conversion of proenzymes to active enzymes, take place in the form of a cascade. Cascade refers to a process that occurs through a series of steps, each step initiating the next, until the final step is reached. Stages of blood clotting. In general, blood clotting occurs in 3 stages: formation of prothrombin activator, conversion of prothrombin into thrombin, conversion of fibrinogen into fibrin. Stage 1, formation of prothrombin activator. Blood clotting commences with the formation of a substance called prothrombin activator, which converts prothrombin into thrombin. Its formation is initiated by substances produced either within the blood or outside the blood. Thus, formation of prothrombin activator occurs through 2 pathways: intrinsic pathway, extrinsic pathway. Intrinsic pathway for the formation of prothrombin activator. In this pathway, the formation of prothrombin activator is initiated by platelets, which are within the blood itself, Fig 20.1. Sequence of events in intrinsic pathway. During the injury, the blood vessel is ruptured. Endothelium is damaged and collagen beneath the endothelium is exposed. When Factor 12, Hogaman factor, comes in contact with collagen, it is converted into activated Factor 12 in the presence of kallikrein and high molecular weight, HMW, kinagen. The activated Factor 12 converts Factor 11 into activated Factor 11 in the presence of HMW kinagen. The activated Factor 11 activates Factor 9 in the presence of Factor 4, calcium. Activated Factor 9 activates Factor X in the presence of Factor 8 and calcium. When platelet comes in contact with collagen of damaged blood vessel, it gets activated and releases phospholipids. Now the activated Factor X reacts with platelet phospholipid and Factor V to form prothrombin activator. This needs the presence of calcium ions. Factor V is also activated by positive feedback effect of thrombin, see below. Extrinsic pathway for the formation of prothrombin activator. In this pathway, the formation of prothrombin activator is initiated by the tissue thromboplastin, which is formed from the injured tissues. Sequence of events in extrinsic pathway. Tissues that are damaged during injury release tissue thromboplastin, Factor 3. Thromboplastin contains proteins, phospholipid and glycoprotein, which act as proteolytic enzymes. Glycoprotein and phospholipid components of thromboplastin convert factor X into activated factor X, in the presence of factor VII. Activated factor X reacts with factor V and phospholipid component of tissue thromboplastin to form prothrombin activator. This reaction requires the presence of calcium ions. Stage 2, conversion of prothrombin into thrombin. Blood clotting is all about thrombin formation. Once thrombin is formed, it definitely leads to clot formation. Sequence of events in stage 2. Prothrombin activator that is formed in intrinsic and extrinsic pathways converts prothrombin into thrombin in the presence of calcium, factor IV. Once formed, thrombin initiates the formation of more thrombin molecules. The initially formed thrombin activates factor V. Factor V in turn accelerates formation of both extrinsic and intrinsic prothrombin activator, which converts prothrombin into thrombin. This effect of thrombin is called positive feedback effect, Fig 20.1. Stage 3, conversion of fibrinogen into fibrin. The final stage of blood clotting involves the conversion of fibrinogen into fibrin by thrombin. Sequence of events in stage 3. Thrombin converts inactive fibrinogen into activated fibrinogen due to loss of 2 pairs of polypeptides from each fibrinogen molecule. The activated fibrinogen is called fibrin monomer. Fibrin monomer polymerizes with other monomer molecules and form loosely arranged strands of fibrin. Later these loose strands are modified into dense and tight fibrin threads by fibrin stabilizing factor, factor XIII, in the presence of calcium ions, Fig 20.1. All the tight fibrin threads are aggregated to form a meshwork of stable clot. Blood clot. Definition and composition of clot. Blood clot is defined as the mass of coagulated blood which contains RBCs, WBCs, and platelets entrapped in fibrin meshwork. RBCs and WBCs are not necessary for clotting process. However, when clot is formed, these cells are trapped in it along with platelets. The trapped RBCs are responsible for the red color of the clot. The external blood clot is also called scab. It adheres to the opening of damaged blood vessel and prevents blood loss. Clot retraction. After the formation, the blood clot starts contracting. And after about 30 to 45 minutes, the straw-colored serum oozes out of the clot. The process involving the contraction of blood clot and oozing of serum is called clot retraction. Contractile proteins, namely actin, myosin, and thrombocytopenia in the cytoplasm of platelets are responsible for clot retraction. Fibrinolysis. Lysis of blood clot inside the blood vessel is called fibrinolysis. It helps to remove the clot from lumen of the blood vessel. This process requires a substance called plasmin or fibrinolysin. Formation of plasmin. Plasmin is formed from inactivated glycoprotein called plasminogen. Plasminogen is synthesized in liver and it is incorporated with other proteins in the blood clot. Plasminogen is converted into plasmin by tissue plasminogen activator, TPA, lysosomal enzymes and thrombin. The TPA and lysosomal enzymes are released from damaged tissues and damaged endothelium. Thrombin is derived from blood. The TPA is always inhibited by a substance called TPA inhibitor. It is also inhibited by factors V and VIII. Besides TPA, there is another plasminogen activator called Urokinase plasminogen activator, UPA. It is derived from blood. Sequence of events involved in the activation of plasminogen. During intravascular clotting, the endothelium of the blood vessel secretes a thrombin-binding protein, the thrombomodulin. It is secreted by the endothelium of all the blood vessels, except the minute vessels of brain. Thrombomodulin combines with thrombin and forms a thrombomodulin-thrombin complex. Thrombomodulin-thrombin complex activates protein C. Activated protein C inactivates factor V and VIII in the presence of a cofactor called protein S. Protein C also inactivates the TPA inhibitor. Now, the TPA becomes active. Activated TPA and lysosomal enzymes activate plasminogen to form plasmin. Plasminogen is also activated by thrombin and UPA, Fig 20.2. Anti-clotting mechanism in the body. Under physiological conditions, intravascular clotting does not occur. It is because of the presence of some physicochemical factors in the body. Physical factors: continuous circulation of blood, smooth endothelial lining of the blood vessels. Chemical factors: natural anticoagulants. Presence of natural anticoagulant called heparin that is produced by the liver. Production of thrombomodulin by endothelium of the blood vessels, except in brain capillaries. Thrombomodulin is a thrombin-binding protein. It binds with thrombin and forms a thrombomodulin-thrombin complex. This complex activates protein C. Activated protein C along with its cofactor protein S inactivates factor V and factor VIII. Inactivation of these two clotting factors prevents clot formation. All the clotting factors are in inactive state. Anticoagulants. Substances which prevent or postpone coagulation of blood are called anticoagulants. Anticoagulants are of three types: anticoagulants used to prevent blood clotting inside the body, i.e. in vivo. Anticoagulants used to prevent clotting of blood that is collected from the body, i.e. in vitro. Anticoagulants used to prevent blood clotting both in vivo and in vitro. 1. Heparin. Heparin is a naturally produced anticoagulant in the body. It is produced by mast cells, which are the wandering cells present immediately outside the capillaries in many tissues or organs that contain more connective tissue. These cells are abundant in liver and lungs. Basophils also secrete heparin. Heparin is a conjugated polysaccharide. Commercial heparin is prepared from the liver and other organs of animals. Commercial preparation is available in liquid form or dry form as sodium, calcium, ammonium, or lithium salts. 4. Oxalate compounds. Oxalate compounds prevent coagulation by forming calcium oxalate, which is precipitated later. Thus, these compounds reduce the blood calcium level. Earlier sodium and potassium oxalates were used. Nowadays, mixture of ammonium oxalate and potassium oxalate in the ratio of 3:2 is used. Each salt is an anticoagulant by itself. But potassium oxalate alone causes shrinkage of RBCs, ammonium oxalate alone causes swelling of RBCs. But together, these substances do not alter the cellular activity. Mechanism of action. Oxalate combines with calcium and forms insoluble calcium oxalate. Thus, oxalate removes calcium from blood and lack of calcium prevents coagulation. Uses. Oxalate compounds are used only as in vitro anticoagulants. 2 mg of mixture is necessary for 1 ml of blood. Since oxalate is poisonous, it cannot be used in vivo. 5 citrates. Sodium, ammonium, and potassium citrates are used as anticoagulants. Mechanism of action. Citrate combines with calcium in blood to form insoluble calcium citrate. Like oxalate, citrate also removes calcium from blood and lack of calcium prevents coagulation. Uses. Citrate is used as in vitro anticoagulant. It is used to store blood in the blood bank as acid citrate dextrose, ACD, 1 part of ACD with 4 parts of blood. Citrate phosphate dextrose, CPD, 1 part of CPD with 4 parts of blood. Citrate is also used in laboratory in the form of formol citrate solution, DASI solution, for RBC and platelet counts. Other substances which prevent blood clotting. Peptone, C-type lectin, proteins from venom of viper snake, and hirudin, from the leech Hirudinaria manilensis, are the known anticoagulants. Physical methods to prevent blood clotting. Coagulation of blood is postponed or prevented by the following physical methods: cold. Reducing the temperature to about 5 degrees Celsius postpones the coagulation of blood. Collecting blood in a container with smooth surface. Collecting the blood in a container with smooth surface like a silicon-coated container prevents clotting. The smooth surface inhibits the activation of factor XII and platelets. So, the formation of prothrombin activator is prevented. Procoagulants. Procoagulants or hemostatic agents are the substances which accelerate the process of blood coagulation. Procoagulants are thrombin. Thrombin is sprayed upon the bleeding surface to arrest bleeding by hastening blood clotting. Snake venom. Venom of some snakes, vipers, cobras, and rattlesnakes, contains proteolytic enzymes which enhance blood clotting by activating the clotting factors. Extracts of lungs and thymus. Extract obtained from the lungs and thymus has thromboplastin, which causes rapid blood coagulation. Sodium or calcium alginate. Sodium or calcium alginate substances enhance blood clotting process by activating the Hogaman factor. Oxidized cellulose. Oxidized cellulose causes clotting of blood by activating the Hogaman factor. Tests for blood clotting. Blood clotting tests are used to diagnose blood disorders. Some tests are also used to monitor the patients treated with anticoagulant drugs such as heparin and warfarin. Bleeding time. Clotting time. Prothrombin time. Partial prothrombin time. International normalized ratio. Thrombin time. Bleeding time. Bleeding time, BT, is the time interval from oozing of blood after a cut or injury till arrest of bleeding. Usually, it is determined by Duke method using blotting paper or filter paper method. Its normal duration is 3 to 6 minutes. It is prolonged in purpura. Clotting time. Clotting time, CT, is the time interval from oozing of blood after a cut or injury till the formation of clot. It is usually determined by capillary tube method. Its normal duration is 3 to 8 minutes. It is prolonged in hemophilia. Prothrombin time. Prothrombin time, PT, is the time taken by blood to clot after adding tissue thromboplastin to it. Blood is collected and oxalated so that the calcium is precipitated and prothrombin is not converted into thrombin. Thus, the blood clotting is prevented. Then a large quantity of tissue thromboplastin with calcium is added to this blood. Calcium nullifies the effect of oxalate. The tissue thromboplastin activates prothrombin and blood clotting occurs. During this procedure, the time taken by blood to clot after adding tissue thromboplastin is determined. Prothrombin time indicates the total quantity of prothrombin present in the blood. Normal duration of prothrombin time is 10 to 12 seconds. It is prolonged in deficiency of prothrombin and other factors like factors I, V, 7 and X. However, it is normal in hemophilia. Partial prothrombin time or activated prothrombin time. Partial prothrombin time, PPT, is the time taken for the blood to clot after adding an activator such as phospholipid, along with calcium to it. It is also called activated partial prothrombin time, APTT. This test is useful in monitoring the patients taking anticoagulant drugs. It is carried out by observing clotting time after adding phospholipid, a surface activator and calcium to a patient's plasma. Phospholipid serves as platelet substitute. Commonly used surface activator is kaolin. Normal duration of partial prothrombin time is 30 to 45 seconds. It is prolonged in heparin or warfarin therapy, since heparin and warfarin inhibit clotting, and deficiency or inhibition of factors 2, V, 8, 9, X, 11 and 12. International normalized ratio. International normalized ratio, INR, is the rating of a patient's prothrombin time when compared to an average. It measures extrinsic clotting pathway system. INR is useful in monitoring impact of anticoagulant drugs such as warfarin and to adjust the dosage of anticoagulants. Patients with atrial fibrillation are usually treated with warfarin to protect against blood clot, which may cause strokes. These patients should have regular blood tests to know their INR in order to adjust warfarin dosage. Blood takes longer time to clot if INR is higher. Normal INR is about 1. In patients taking anticoagulant therapy for atrial fibrillation, INR should be between 2 and 3. For patients with heart valve disorders, INR should be between 3 and 4. But, INR greater than 4 indicates that blood is clotting too slowly and there is a risk of uncontrolled blood clotting. Thrombin time. Thrombin time, TT, is the time taken for the blood to clot after adding thrombin to it. It is done to investigate the presence of heparin in plasma or to detect fibrinogen abnormalities. This test involves observation of clotting time after adding thrombin to patient's plasma. Normal duration of thrombin time is 12 to 20 seconds. It is prolonged in heparin therapy and during dysfibrinogenemia, abnormal function of fibrinogen with normal fibrinogen level. Applied physiology. Bleeding disorders. Bleeding disorders are the conditions characterized by prolonged bleeding time or clotting time. Bleeding disorders are of 3 types: hemophilia, purpura, von Willebrand disease. Hemophilia. Hemophilia is a group of sex-linked inherited blood disorders, characterized by prolonged clotting time. However, the bleeding time is normal. Usually, it affects the males, with the females being the carriers. Because of prolonged clotting time, even a mild trauma causes excess bleeding which can lead to death. Damage of skin while falling or extraction of a tooth may cause excess bleeding for few weeks. Easy bruising and hemorrhage in muscles and joints are also common in this disease. Because of prolonged clotting time, even a mild trauma causes excess bleeding which can lead to death. Damage of skin while falling or extraction of a tooth may cause excess bleeding for few weeks. Easy bruising and hemorrhage in muscles and joints are also common in this disease. Causes of hemophilia. Hemophilia occurs due to lack of formation of prothrombin activator. That is why the coagulation time is prolonged. The formation of prothrombin activator is affected due to the deficiency of factor VIII, IX, or XI. Types of hemophilia. Depending upon the deficiency of the factor involved, hemophilia is classified into 3 types: hemophilia A or classic hemophilia, due to the deficiency of factor VIII. 85% of people with hemophilia are affected by hemophilia A. Hemophilia B or Christmas disease, due to the deficiency of factor IX. 15% of people with hemophilia are affected by hemophilia B. Hemophilia C or factor XI deficiency, due to the deficiency of factor XI. It is a very rare bleeding disorder. Symptoms of hemophilia. Spontaneous bleeding. Prolonged bleeding due to cuts, tooth extraction and surgery. Hemorrhage in gastrointestinal and urinary tracts. Bleeding in joints followed by swelling and pain. Appearance of blood in urine. Treatment for hemophilia. Effective therapy for classical hemophilia involves replacement of missing clotting factor. Purpura. Purpura is a disorder characterized by prolonged bleeding time. However, the clotting time is normal. Characteristic feature of this disease is spontaneous bleeding under the skin from ruptured capillaries. It causes small tiny hemorrhagic spots in many areas of the body. The hemorrhagic spots under the skin are called purpuric spots, purple-colored patch-like appearance. That is why this disease is called purpura. Blood also sometimes collects in large areas beneath the skin which are called ecchymoses. Types and causes of purpura. Purpura is classified into 3 types depending upon the causes: Thrombocytopenic purpura. Thrombocytopenic purpura is due to the deficiency of platelets, thrombocytopenia. In bone marrow disease, platelet production is affected leading to the deficiency of platelets. Idiopathic thrombocytopenic purpura. Purpura due to some unknown cause is called idiopathic thrombocytopenic purpura. It is believed that platelet count decreases due to the development of antibodies against platelets, which occurs after blood transfusion. Thrombasthenic purpura. Thrombasthenic purpura is due to structural or functional abnormality of platelets. However, the platelet count is normal. It is characterized by normal clotting time, normal or prolonged bleeding time but defective clot retraction. Von Willebrand disease. Von Willebrand disease is a bleeding disorder, characterized by excess bleeding even with a mild injury. It is due to deficiency of von Willebrand factor, which is a protein secreted by endothelium of damaged blood vessels and platelets. This protein is responsible for adherence of platelets to endothelium of blood vessels during hemostasis after an injury. It is also responsible for the survival and maintenance of Factor VIII in plasma. Deficiency of von Willebrand factor suppresses platelet adhesion. It also causes deficiency of Factor VIII. This results in excess bleeding, which resembles the bleeding that occurs during platelet dysfunction or hemophilia. Thrombosis. Thrombosis or intravascular blood clotting refers to coagulation of blood inside the blood vessels. Normally, blood does not clot in the blood vessel because of some factors which are already explained. But some abnormal conditions cause thrombosis. Causes of thrombosis. Injury to blood vessels. During infection or mechanical obstruction, the endothelial lining of the blood vessel is damaged and it initiates thrombosis. Roughened endothelial lining. In infection, damage, or arteriosclerosis, the endothelium becomes rough and this initiates clotting. Sluggishness of blood flow. Decreased rate of blood flow causes aggregation of platelets and formation of thrombus. Slowness of blood flow occurs in reduced cardiac action, hypotension, low metabolic rate, prolonged confinement to bed and immobility of limbs. Agglutination of RBCs. Agglutination of the RBCs leads to thrombosis. Agglutination of RBCs occurs by the foreign antigens or toxic substances. Toxic thrombosis. Thrombosis is common due to the action of chemical poisons like arsenic compounds, mercury, poisonous mushrooms and snake venom. Congenital absence of protein C. Protein C is a circulating anticoagulant, which inactivates factors V and VIII. Thrombosis occurs in the absence of this protein. Congenital absence of protein C causes thrombosis and death in infancy. Complications of thrombosis. Thrombus. During thrombosis, lumen of blood vessels is occluded. The solid mass of platelets, red cells, and or clot, which obstructs the blood vessel, is called thrombus. The thrombus formed due to agglutination of RBC is called agglutinative thrombus. Embolism and embolus. Embolism is the process in which the thrombus or a part of it is detached and carried in bloodstream and occludes the small blood vessels, resulting in arrests of blood flow to any organ or region of the body. Embolus is the thrombus or part of it, which arrests the blood flow. The obstruction of blood flow by embolism is common in lungs, pulmonary embolism, brain, cerebral embolism, or heart, coronary embolism. Ischemia. Insufficient blood supply to an organ or area of the body by the obstruction of blood vessels is called ischemia. Ischemia results in tissue damage because of hypoxia, lack of oxygen. Ischemia also causes discomfort, pain, and tissue death. Death of body tissue is called necrosis. Necrosis and infarction. Necrosis is a general term that refers to tissue death caused by loss of blood supply, injury, infection, inflammation, physical agents, or chemical substances. Infarction means the tissue death due to loss of blood supply. Loss of blood supply is usually caused by occlusion of an artery by thrombus or embolus and sometimes by atherosclerosis, Chapter 67. Area of tissue that undergoes infarction is called infarct. Infarction commonly occurs in heart, brain, lungs, kidneys, and spleen.